And welcome. As a physical therapist, you are on the front lines helping children move, play, and explore their world. You have a unique and powerful role. You get to see firsthand how movement shapes a child's life. But to do your job brilliantly, you need to understand what's happening beneath the surface. This is where pediatric neurology comes in. It's the fascinating field that studies the developing brain and nervous system. Think of it as the instruction manual for the body's electrical wiring. Understanding this manual is not just for doctors, it's absolutely essential for you too. It helps you understand the why behind the movement challenges you see every day in the clinic. So, why should you care so much about the brain? Every single movement a child makes, from a tiny finger twitch to a joyful leap, starts with a signal from the brain. The brain sends messages down the spinal cord out through the nerves to the muscles. It's a complex and beautiful dance of electrical impulses. When there is a disruption in this system, it can affect a child's ability to control their muscles, maintain balance, or coordinate their movements. As a physical therapist, you are essentially a movement detective. Your job is to figure out where the communication breakdown is happening, and how you can help the body find new pathways to make movement possible. Imagine you have two children with similar difficulties in walking. One might have an issue with muscle strength, while the other might have a neurological condition like cerebral palsy. For the first child, you might focus on strengthening exercises. For the child with cerebral palsy, you'll be working to help their brain learn new ways to control the muscles it already has. By understanding the underlying neurology, you can create a therapy plan that is not just effective, but truly tailored to the child's specific needs. You move from simply treating the symptom to addressing the root cause, which is far more powerful. This knowledge empowers you to be a better clinician and a more effective advocate for your young patients. It allows you to explain to parents, in simple terms, what is happening with their child's body. You can set realistic and meaningful goals together. You can celebrate the small victories, knowing the incredible neurological effort that went into each one. This essay is your friendly guide to some key topics in pediatric neurology. Let's talk about a term you'll hear a lot: cerebral palsy, or CP. It sounds complicated, but let's break it down. Cerebral refers to the cerebrum, the main part of the brain. Palsy means weakness or trouble using muscles. So, cerebral palsy is a group of disorders affecting movement, balance, and posture. It's the most common motor disability in childhood. CP is caused by abnormal brain development or damage to the developing brain. That damage can happen before birth, during birth, or in the first few years of life. CP is not a disease, it doesn't get worse over time, and it's not contagious. There isn't a single cause. Often the exact reason is unknown. During pregnancy, infections or lack of oxygen to the baby's brain can cause damage. Premature birth is a major risk. Fragile brains are more easily injured. A difficult birth with low oxygen can also cause damage. After birth, meningitis, head injury, or problems with blood flow to the brain can result in CP. In most cases, it's not the family's fault. Because CP affects movement control areas of the brain, signs are motor-related. Early sign: delayed motor milestones. A baby may seem very stiff or very floppy. You might see unusual postures or favoring one side of the body. Example: consistently using one hand to reach. Later signs: scissoring of the legs, toe walking. These clues show the brain is struggling to send correct signals to muscles. Types of CP depend on which brain area is affected. Spastic CP: stiff, tight muscles, most common. Dyskinetic CP: uncontrollable movements, slow or jerky. Ataxic CP: balance and coordination problems, shaky gait. Many children show a mix of these. As a physical therapist, early identification is crucial. Your keen eye can lead to early diagnosis and earlier support, improving long-term outcomes. We'll dive into conditions like cerebral palsy, spina bifida, explore developmental milestones, and share practical tips you can use right away. Now let's move on to another important condition, spina bifida. This one is a bit different from cerebral palsy because it's a problem with the spinal cord, not the brain itself. Spina bifida is a type of birth defect called a neural tube defect. The neural tube is the structure in a developing embryo that eventually becomes the baby's brain and spinal cord. In spina bifida, the neural tube doesn't close all the way. This leaves a gap in the bones of the spine, and sometimes the spinal cord and its covering membranes can push through this opening. It happens very early in pregnancy, often before a woman even knows she is pregnant. The exact cause isn't fully understood, but it's thought to be a mix of genetic and environmental factors. One of the most significant discoveries in preventing spina bifida is the importance of folic acid. Folic acid is crucial early on, and daily supplementation can dramatically reduce cases. Simple public health measures with massive impact. Other risk factors might include a family history of neural tube defects or certain medications. How does spina bifida affect movement? It depends on the level and how much the cord is affected, like a highway with a roadblock. Higher thoracic, upper lumbar levels often mean more weakness and wheelchair use. Sacral levels can be milder, sometimes walking with AFOs or crutches. Bladder and bowel control can be affected due to sacral nerve involvement. Section 4. Your Guide to Developmental Milestones. The building blocks of movement. Milestones are checkpoints, skills most children can do by a certain age, across movement, speech, learning, and play. For you, motor milestones are your bread and butter, the roadmap of typical development. Use the roadmap to see if a child is on track or needs extra help. It's a guide, not a race. Every child is unique. A slight delay isn't always alarming, but patterns matter. First months, gaining head and neck control. By 3 to 4 months, lift and hold the head in tummy time. Tummy time builds strength. By 6 months, roll tummy to back and back to tummy. Begin sitting propped on hands, core and balance foundations. 9 to 12 months, sit without support, crawl, creep, scoot, and explore. Many pull to stand and take cruising steps. By 12 to 15 months, first independent steps, wobbly but monumental. 18 to 24 months, walking well, starting to run, stairs with hand support, kicking a ball. By 3, ride a tricycle, stand on one foot briefly, walk stairs alternating feet. By 4, hop and maybe skip. By 5, somersault and swing independently. Knowing milestones helps target needs and design playful interventions. Section 5. Practical tools for your therapy toolbox, assessment and intervention. You have a child in your clinic. You suspect a delay. What do you do? First, a thorough assessment. Not just strength. Be a careful observer. Watch spontaneous movement. How do they play? How do they transition? Sitting, crawling? Use a developmental milestone checklist. Observe tone, hypertonic, tight, or hypotonic, floppy. Check reflexes, moro, startle. If they persist, consider neurological signs. Plan therapy interventions. Make therapy feel like play. Children want fun, not drills. Get creative. Tummy time engagement. Get on the floor, use colorful toys, mirrors, and songs. To encourage rolling, place a toy just out of reach. This is task-oriented training focused on meaningful function. Example: spastic CP with toe walking. Use gentle, prolonged calf stretching. Encourage heels down through squats and walking up a small ramp. Use NDT handling. Provide repeated experiences to build new neural pathways. Spina bifida. Learn wheelchair skills with upper body and core strengthening. Practice navigating obstacles, ramps, safe transfers, and regular skin checks for pressure sores. Goals: increase independence, participation, and quality of life. Unlocking potential to interact with the world. Section 6. The heart of the matter. Working with children and their families. Working with children is a privilege requiring special skills. You're not just treating muscles and bones. You're supporting a whole person with feelings, fears, and a desire to play. Be patient, silly, and flexible. Some days you may throw out the plan and just blow bubbles or build a block tower. That's okay. A trusting, positive relationship underpins all successful therapy. Families face emotional diagnoses and confusing jargon. Be a calm, clear, reassuring voice. Explain what you do and why in simple language. Instead of dissociating girdles, say, "We're helping him twist to reach toys more easily." Parents understand the purpose. Parents are experts on their child. Listen to concerns, goals, observations. Involve them with simple activities at home, like gentle stretches during diaper changes or while watching a favorite show. Empower parents to participate and celebrate every small victory. One step with a walker can be monumental. Your encouragement makes a world of difference. You are a coach, an educator, and a source of support. We've covered a lot, from the brain's wiring to making therapy feel like play, from cerebral palsy and spina bifida to developmental milestones. You don't need to be a neurologist to be exceptional. What you need is curiosity, compassion, and a solid grasp of fundamentals, your compass. You are a movement expert. Your skills are incredibly valuable. First, understand the why. Know the neurological basis to build smarter plans. Second, Be a keen observer. Use milestones to spot delays early. Third, make it fun. Therapy equals play, exploration, and confidence building. Finally, partner with the family. Educate, empower, and encourage. You help kids engage with their world, play with friends, keep up with siblings, and participate in family life. You are changing lives, one small movement at a time. Thank you for all that you do.